Dear partners in health, we welcome you on behalf of the Health Hub team and Health Policy Radar. My name is Anita Bujanic, and as the founder of Health Hub, I will also be your host in this first specialized policy dialogues of our think tank of this kind, which covers up-to-date health policies in the region. Through a series of dialogues on relevant trends and challenges in healthcare, Health Policy Radar will give you a view toward the future of health policies. In expectation of EU elections, it is more than ever important not to miss the opportunity to talk about health topics of great importance to every EU citizen, member states, and our European Union in general. At numerous events dedicated to sustainability, healthcare is most often bypassed, showing that awareness of all the advantages that the green mindset of healthcare institution offers to patients, institutions, the healthcare system, the state, and the entire planet is still insufficiently developed. As it was highlighted during European Health Forum in Gastein, in the next few decades, the healthcare sector is predicted to both expand and evolve, driven by demographic changes in developing markets, technological advances, and improved understanding of the causes of positive health outcomes. However, climate change poses a clear threat to population health and healthcare delivery. One of Gastein's sessions highlighted how crucial it is for European healthcare systems to take responsibility for their impact on the climate crisis, tackling healthcare's waste problem and its carbon footprint. Can we make healthcare greener? Can we build the workforce and health management with green awareness and mindset? And what changes are necessary to introduce to our ecosystem to shape sustainable future of our healthcare system, but also to protect our communities in an aspect of climate changes? This is the focus of today's Health Policy Radar. I would like to give a warm welcome to our guests, Mrs. ANDREA ČOVIĆ-VIDOVIĆ, representation of European Commission in Croatia. Welcome.
Thank you.
Thank you for being with us. And Mrs. TATJANA SKOKO from Microsoft, experienced manager with respectable expertise in sustainability. TATJANA, welcome.
Thank you.
I have found recently one quite interesting quote from Arnold Schwarzenegger. You know him all from being an actor and former governor of California. He quoted, I've starred in a lot of science fiction movies, and let me tell you something. Climate change is not science fiction. This is a battle in the real world, and it is impacting us right now. So, Mrs. ČOVIĆ-VIDOVIќ, it is not definitely a coincidence that the European Commission selected specific quotes for Next Generation EU, stated, make it healthy, make it digital, make it green, make it strong, make it real. Why is that the Commission included this concept of green and healthy Europe?
Well, simply because we need to stay on board. We need to actually steer our global boat, to be honest. And it's, I like it that you are quoting an American politician, because yes, in California, there is some similar views with Europe when it comes to sustainability and green. But I'd like to remind you and the viewers of our European Green Deal, which is the concept pushed by this Commission back in 2019, because we all need to have this planet, not just this year, not in 5 years' time, not just in 10 years' time. If you look at the statistics, we need to preserve it for our children's children.
For the next generation.
And the one coming after. So I would say Next Gen EU is a good concept as well, another thing that we're working on. But what I need to highlight is the pioneering role of Europe. We are pushing for the climate neutrality on a global scale. We're raising the bar for other actors such as the US, which you have mentioned, but also China, a lot of global players that are looking up to Europe, more or less willingly, because we're setting the standards. We are setting the standards institutionally. Everything in terms of legislation is in place. Now we have implementation that awaits, and I believe with the new Commission at the end of 2024, we will continue in this course of setting the pace for the rest of the world, really.
You mentioned the mission of European Commission, and actually the first priority of the Commission of President Ursula von der Leyen was to make the EU the world's first climate neutral continent. Why the European Commission decided to go with this green vision, taking into consideration the fact that at the same time, especially after the pandemic, the Commission recognized also the importance of health. How can we align the green vision together with the vision of healthier Europe in European Health Union?
Well, it is inseparable because at the core even of the Green Deal and of the green policies is the individual, is the European citizen. And of course, we want European citizens to live long and healthily. And, you know, we do live longer, we will live longer, we will live up to, you know, potentially even to 100. There's some data that shows that.
Fingers crossed.
Yes. So, and we want our population active. And of course, without healthy air, without healthy water, without, you know, all the facilities needed for our lives to have this quality aspect, it's impossible. So I would say they're really intertwined stories. I think also it's important for everyone watching to grasp that the green is a cross-sectorial issue. There simply is not, there does not exist a sector in which green and sustainable would not have relevance, and this includes, of course, the healthcare.
In some way, it reminds me of the concept of health in all policies. Now we have the green in all policies, which is quite, I would say, similar, taking into consideration the fact that you're Mrs. Skoko, so experienced in the field of sustainability policies and health manufacturing industry. Do we need to work on the mindset of the industry to think in a more green way, a more sustainable way? And what do you think about the success of implementing maybe data science or AI concept in healthcare industry, because it is definitely aligned with sustainable development goals?
Yes. So in regards to the healthcare, and I was working very much with manufacturing pharmaceutical companies. So today, pharmaceutical manufacturing companies are emitting more CO2 than the automotive industry, which is, and that's why they are very much committed to the sustainability goals. We see a lot of efforts with this pharmaceutical company and healthcare industry as such. And yes, we believe that technology, artificial intelligence and data plays a crucial part. Data in every industry is bringing specific, unique insights to an industry. But we still see that industries are not taking the full scope of this data. For example, in a manufacturing industry, only 2% of all the data is being used for making some insights. So there is a huge volume of data that is still being unused, which can bring a lot of insights to every industry and healthcare as such. So working with pharmaceutical companies in the region, we see that they are implementing more and more artificial intelligence. For example, as we know, 70 to 80% of CO2 emission happens in the manufacturing process, so in the core process of the company. And what some of the pharmaceutical companies are implementing is a technology called the digital twin. What is this technology? Actually, it's a virtual replica of a physical space or a physical process or a factory as such. But how does it happen? You have to get clear all the data. For example, if we take a production process, we get the data from each of the machine. We use 3D modeling, and we do a virtual replica of the process. By having all this data, a manufacturing company is being able to see exactly how much CO2 emission and energy is being consumed by each of the machine. They can see where are the bottlenecks. And when you have such a process in a virtual space, by using artificial intelligence, you can predict and you can play with the process and see what would be the most efficient process in a pharmaceutical manufacturing company that is bringing the lowest CO2 emission and the lowest energy consumption. So these are just some of the examples how pharmaceutical companies are using these innovative technologies to be more sustainable and greener in their business.
You mentioned amazing, inspiring trends in medtech industry, the digital transformation of the pharma manufacturing industry. Do we maybe, when we speak about the green healthcare, do we have some bottlenecks that are, I would say, an obstacle to go towards the green transformation of the healthcare, taking into consideration that healthcare is always quite specific. We still do not have, I would say, sufficiently skilled workforce to think green. Where do you see the potential?
Yes. Actually, I mean, the potential to explore and to use the technology is very powerful. We need to accelerate our efforts. And some of the areas where companies are working and are working toward, definitely, as you mentioned, Anita, is the skilling. When we talk about sustainability, we have three levels, for example, of the skilling. One is the core sustainability skilling expertise, and this is like in a company, some people need to know about carbon accounting. Then we have a second pillar of the skilling is for people, for example, in a supply chain, they should have skills to understand how and what they need to do in order for these supply chains to move more into a sustainable operations, and how, for example, use technology to make the supply chain more sustainable. And the third level of the skill is the overall, I would say, general skills about awareness. What are we doing every day to make, you know, our lives more sustainable, and how we can work jointly to a more sustainable future. Definitely is the skilling, and as I mentioned, the usage of data. Data is the core, I would say, of the digital transformation and core of, you know, getting us into a more greener future. But from my experience and working with the customers, they are on this journey, and they are, you know, tackling this area and working on those.
Thank you, Mrs. Skoko. You actually prepared the field for the question for Mrs. ČOVIĆ-VIDOVIĆ. During the recent and again mentioned the European Health Forum in Gastein, which is, I would say, the highlight and lighthouse of the policy trends in European horizon, they mentioned quite often that the hospitals need to become green hospitals, that we need to develop this green mindset of healthcare systems throughout Europe. The Commission really prepared the field, I would say, with amazing initiatives that also utilize the data. The European Health Data Space is the first digital connection of member states, I would say. So the healthcare, I would say, put the first step towards this integration of the member states. Can you mention maybe some initiatives beside that that are a demonstration of the Commission's vision toward the greener and healthier Europe?
Absolutely. I would say that the biggest kick was actually the pandemic. It was a horrible thing to have happened, but it has pushed Europe towards, indeed, and there's a name for it now, a European Health Union, which maybe some years back would have been unimaginable as a concept even, because as you know, health is in the member states' capacities. However, we've seen and learned that, you know, diseases and even lifestyles and some trends that might be a little negative when it comes to our health, they don't know borders. So we are pretty much and most of the time facing very similar problems. So I'd say the concept of this health union is there. We are using, at the core of it is definitely the single market. So some mechanisms that were activated during Corona times have now become functional in different ways. So when there's a deficiency in the number of, let's say, antibiotics in one member state, the member state will resort to the supplies in other member states. So there's this reciprocity and there's this solidarity that has grown with time and obviously also with the crisis. And then again, as you said, the Commission has prepared the ground well and has prepared the ground even when speaking about green and sustainability in all sectors, including healthcare. And I would say one of the biggest breakthroughs was definitely the Europe's Fighting Cancer Plan, which, as you know, probably most of the lives are taken yearly by diseases that are preventable, among them some forms of cancer that are completely, you know, treatable when spotted on time, also preventable with certain lifestyles. So the Commission has really done a lot in this area because, as I said, lifestyles are a common thing in Europe not necessarily the good ones. So we need to be changing the mindset of people, but also of healthcare facilities. And we also need to be focusing a lot more on prevention from an early age, from kindergarten. We, each and every one of us has to take responsibility also for our health and for our well-being in the amount in which it is possible, of course. And the Commission is there to help the representation in Croatia, to help communicate about these topics.
And let's not forget that some of the preventable cancers are also related to climate change, such as the biggest cancer killer in Europe, lung cancer and melanoma related to UV exposure. Mrs. Skoko, you're recognized as a true, I would say, visionary of business diplomacy. Why is this digital green concept so much important, not only for you personally, but also for your company, taking into consideration the fact that you have been working within this field for more than a decade with so many healthcare partners, and why is it so important now, especially in the past few years, to speak about digital and green concept of healthcare?
Yes, so for me personally as well as for the company, I think it's an opportunity, but it's also a responsibility. And we always need to act together in a partnership. So each one of us is bringing some unique perspective and insights. And I think, you know, to make our life greener and better for future generations, we need to do it in a partnership. When I look from a company perspective, we truly believe that technology innovations are bringing, you know, a better world at the end of the day. And when looking at the Microsoft, it always starts with us, like with us personally. So working on the sustainability journey, Microsoft first was thinking about getting its house in order, so our operations need to be in processes sustainable. And then the next step is, of course, supporting our partners and customers on their sustainability journey by giving them green technology. And the third pillar, of course, is supporting different government institutions. We are supporting policy makings in the area of sustainability, providing different skilling programs. So these are the ways how we are supporting and working jointly toward a greener future.
This is quite inspirational partnership, and this is something that we need to promote even more, not only in Croatia, but in the region overall. During the European Health Forum in Gastein, there was a strong message on increasing trends of making hospitals more sustainable by addressing the myriad of challenges they are facing. Informed by the research conducted in different European countries as part of the Partnership for Health System and Sustainability and Resilience, or PHSSR, the research showed how crucial it is to raise workforce awareness of environmental risk factors by supporting efforts to build knowledge through innovative medical education. The PHSSR research findings will help definitely to inform policy options to prioritize solutions to decarbonize healthcare system, highlighting the importance of innovative partnerships for health system resilience and sustainability. Let's hear more about this initiative and key recommendations towards green and sustainable healthcare.
I think if we look within PHSSR, we see that most countries, there are policies for emission reductions, but they are primarily also focused more on overarching public and industrial policies and not specifically to the healthcare system. So we see that in some EU countries, for example, many countries, they are developing specific health system emission reduction policies. So I think most of you know maybe also about the Netherlands, that they have their own Green Deal. And so there are multiple countries. So for example, in Greece, we see also in the Greek reports that they described that the development of an action plan to reduce the energy footprint of health institutions, which is also in line with their overarching national energy and climate plan. But I think often it's about plans and about research indeed so far. And now we need to move towards action and implementation and actually doing that indeed with the funds that are available. So we also hope that these kind of reports and research really shows how also the health systems can be more sustainable and that it gives the tools and the information needed to indeed also inform and educate all partners involved, because there are many organizations involved in making the healthcare system more sustainable. And we talk about the fact that healthcare systems should be able to deliver on the quality care on the long term. So not only the environmental sustainability part, but sustainability in a broader sense. But we have added population health and environmental sustainability as new pillars to the overarching building framework, to the overarching building blocks. And we have actually now indeed discussions how we can integrate environmental sustainability into the other 6 instead of having it as a separate building block. But so far it's a framework that is always in development, also based on research that is happening in this field. We have now investigated almost 30 countries, sometimes with full country assessments and sometimes with more overarching reports, like in CIBA. And we think these insights also show challenges and strategies that are relevant for countries beyond the countries that are studied. But we indeed want to expand the research and the reach of the research as well, both with including new partners that are interested in this specific research and that would like to team up with the current partners, but also with new research institutes in the country, so national research institutes and national governments to perform these country assessments in other countries as well. We facilitate also cross-country learnings. So we, for example, now recently started with an EU expert advisory group. So on an EU level, there is an PHSSR advisory group that is specifically looking into the recommendations that could be useful on an EU level for Brussels, also with involvement from different MEPs. So to also learn across EU countries, thereby, for example, in the APAC region, also the research that is performed there, they also have more a regional hub, learning from each other across borders. So I think this is in more in general and call also to action that if you are interested in this partnership, or if you would like to be actively involved, or if you see opportunities for a country assessment, or maybe a specific deep dive into a topic, because I can also understand that this is quite a broad research covering a lot of parts of health system sustainability and resilience. But we also are looking into deep dive projects to, for example, look more into environmental sustainability or prevention of NCDs, and work together with partners on this. So feel free to reach out if you see opportunities to team up.
After we heard the PHSSR leadership, vision and mission, now we're back again to the studio. Mrs. ČOVIĆ, VIDOVIĆ, the healthcare sector, which includes definitely the public health system, hospitals, primary health system and pharmaceutical companies, is actually a major contributor of harmful emissions and waste. Are we doing enough in this region, especially in eastern part of Europe and central part of Europe, to address this as an issue for healthcare?
There are definitely norms and standards across board, which are the same for everyone. I believe all industry, including the healthcare industry, should be doing more, because we do need to speed things up. We do have ambitious goals, and to reach them, even that sector has to absolutely contribute. Of course, the individual implementation of all the green recommendations is on member states. The Commission always obviously monitors whenever there's a breach of EU law. We do issue warnings. There's even penalties, of course, for some actors that do not adhere to the guidelines and to the legal principles that we've agreed to. As you know, there's the Commission. We suggest legal formats. Then you have the Parliament, European Parliament, and the member states who ultimately agree. So everything that we are talking about has basically been agreed within member states and by member states. So there is a commitment. Whenever something has a legal form in Europe, there has already been a commitment to reach that form. And now the implementation represents another level of commitment, which is very important. I don't know if I'm getting too technical here, but there are concrete penalties even when we're speaking about not obeying the rules that we have all agreed to.
The Commission really gave us, I would say, quite clear instructions, useful tools toward the sustainable development goals, achieving ESG principles, thinking more green, etc. But Mrs. Skoko, Do we need to articulate more in this part of Europe this green healthcare concept? Do we need to speak more, talk more about this issue, because we still somehow do not see the opportunity for our hospitals to transform their ways of working to become paperless hospitals, that they use new medical technology with less consumption of energy, gas emission, etc. So do we need to speak more and more frequently about this concept?
Yes, definitely. I would say we need to speak more, and we need to accelerate efforts, as the colleague said as well. And what I also emphasized before, and this is a long-term also journey for the whole planet, I would say, and we need to do it in a partnership. So it's very important that we are all engaged, looking at the startups, universities, governments, companies. So each one of us plays a crucial role. For example, governments are setting the regulatory framework. Startups are bringing the innovation that we can have with the sustainability. Technology company like Microsoft and others are bringing the technology and different programs to enhance sustainability journey. Universities are, scaling the next generation of people with the skills that we need for our sustainability goals. So I would say yes, it's never enough to speak, to bring awareness, and we need to do it in a partnership.
And you mentioned this partnership and collaboration with different entities. What is your experience throughout the past several years? What is the role of tech companies such Microsoft is actually in achieving sustainability goals? Actually, you serve as a lighthouse towards those partners because you have the green technology.
Yes, exactly. From one point is definitely bringing the technology that is green. For example, we have also ambitious goals, and by 2025, we will operate the data centers completely on renewable energy. So if customers are using our services from the data centers, they will achieve more than 90% energy saving and lowering their CO2 emissions. So by using technologies, from one hand, you are speeding up the digital transformation, which is very much connected to the sustainability. But apart from the technology, we are also, very active in the skilling programs through our LinkedIn platform. We are very much engaged with the policymakers, with the governments. So this is the role that we are playing, and for us, definitely the goal is to accelerate the sustainability journey where we are all participating.
This is definitely a win-win partnership, not only for the companies, for the government, but for the society, I would say, and planet in general. What is actually that we need to do in order to transform healthcare to think green and sustainable and mitigate the negative impact of the healthcare system on the environment? It was one of the global issues that HealthHub, as a regional think tank, has decided to face in a timely manner. Initiated during the June 2023, a gathering of European experts in the field of green healthcare. The Green Healthcare Policy Summit was held hybridly, supporting the initiatives of the European Commission, Green Deal, Next Generation EU and European Health Union, with the aim to make healthcare institutions in the CE region aware of the numerous opportunities for European funding that are offered for the projects with a green, sustainable and digital philosophy. Sharing best practices means that you are not repeating the same mistakes, but taking the most efficient and fruitful route to solving a problem. And that eliminates the wasted time and monetary costs that often come with trial and error for finding the right approach. And we do not have much time. This was a strong message from an inspiring team of Polish Hospital Federation, experienced in advocacy for green hospitals. Let's hear their statement, and then we are back to the studio for final takeaways.
Today, I am before you to advocate for a cause that is close to all of our hearts: the development of green hospitals and the sustainable healthcare practices. Our federation has initiated a coalition committed to promoting sustainable development and environmental protection in the healthcare sector. We believe that hospitals have a crucial role to play in combating the climate change and promoting sustainability. We envision the healthcare system not only that one that provides excellent patient care, but also respects and protects our environment. Our initiative is based on three main pillars. The first one is education and awareness. The second is policy advocacy. And the third is research and innovation. Now, how we aim to do that? We aim to educate healthcare professionals and the public about the importance of sustainability in healthcare. We advocate for policies that promote sustainability in healthcare working spaces, working with government agencies, healthcare organizations, and other stakeholders. We also conduct research to identify best practices for sustainability in the healthcare sector and promote innovation by supporting the development of new technologies and processes that can make hospitals more sustainable. We are at a crucial juncture where the need for sustainable practices in healthcare is more pressing than ever. The medtech's green moment is here, and it presents an opportunity window for healthcare management to transform the care we provide, to innovate. And the innovative pharma is going green, redesigning cancer care and minimizing the environmental impact of pharmaceuticals and pharmacy practice. Now, we invite you to join us on our mission to create a greener, healthier future for all. Together, we can make a big, big difference. Let's seize this moment to transform healthcare into a sector that heals not just patients, but our planet too. Thank you.
And we are back to the studio for final takeaways. Mrs. ČOVIĆ, can this society in general, I would say, including the healthcare stakeholders, become a green policy ambassadors, and can we make this vision really work?
We have to believe it to achieve it, I would say. And as a continent, we have put this moral responsibility upon us. The Commission has put it on each and every one of us as citizens, which of course it is in our best interest to do. So policy, laws, we have put those in place, but we need to act upon it even as individuals. So the call is on every one of us as well. And the pledge is important, and we are talking about the future, not only of this country, not only of the region, not only of Europe as a continent, we're talking about the global future.
A big thanks to European Commission for bringing this spark in our society. It's up to us to follow actually the light that you have I would say, put in front of us. And Mrs. Skoko, at the end of today's Health Policy Radar, what would be your green takeaway message, or I would say a green policy moonshot for the healthcare?
Well, I would say it also starts with each one of us. So it's important that we inspire each other as well and do every day, you know, put an effort to have a more sustainable life. And yes, definitely by our collective efforts and by bringing us all together in a partnership, we will achieve the sustainability goals.
Thank you to both of you once again. It was a true pleasure to have you here as a guest, and thank you for sharing the same passion and vision towards the greener healthcare, greener society, and hopefully we will have an opportunity to meet again in Health Policy Radar for some other topics. At the end of this Health Policy Radar, I would quote the former US President Barack Obama. He said, "We are the first generation to feel the effect of climate change and the last generation who can do something about it." Dear guests, you showed us that you're really doing something in this field, and we are here to support you in your mission. We have to further lead the discussion on key areas where health technology purchaser in Europe can integrate green criteria in the procurement process to stimulate innovations and advancements in healthcare, to increase value for money and to reduce the pressure that health systems place on the global environment. After our Green Healthcare Policy Summit, Health Hub continues to lead bold regional dialogue between many stakeholders, and hopefully deeper engagement on sustainable procurement and green hospital initiatives will surely follow, so we can all build more productive and resilient delivery of healthcare services, especially in post-pandemic period for more efficient recovery. There is no any doubt that we will have that green healthcare will be on our policy radar in 2024 and beyond. Thank you for being with us, and let's connect again on very interesting topics on Health Policy Horizon.